let's talk about facial rejuvenation in terms of plastic surgery. So what are different modalities जिसके through हम facial rejuvenation कर सकते हैं? First of all, as we age, we see signs of aging on our face. How does that appear? सबसे पहले fine lines आएंगी, wrinkles आएंगे, and what is the cause of that? हमारे स्किन की इलास्टिसिटी लूज होती है विद एज एंड मोस्ट इंपॉर्टेंटली देयर इज स्ट्रक्चरल चेंज इन द शेप ऑफ द फेस. व्हाई डज दैट हैपन? देयर आर डिफरेंट फैट पैड्स विद इन आवर फेस. विद एज वो फैट पैड्स साइज में डिक्रीज करते हैं एंड डिसेंड करते हैं. नाउ व्हाई इज फेशियल रिजुविनेशन इंपॉर्टेंट? By doing all these rejuvenative procedures, we are actually decreasing the biological age. And what it finally leads to is that when you look yourself in the mirror, you actually look and you feel younger. So for all these rejuvenative procedures, these are the options that we have. First of all, जो structural change है, उसको reverse करने के लिए we have to do a structural surgery in itself. सबसे minimally invasive way to do it is by rejuvenating your fat pads. वो कैसे कर सकते हैं? हम fat liposuction करके from your lower belly area or your thighs region उस fat को process कर सकते हैं into micro fat and we can inject it into your face. How is that any different from synthetic filler? One, ये बिल्कुल natural है in the sense that these are your own cells, so your body has no reaction against them. Two, since there is no reaction against your own cells, there is no lymphatic obstruction caused by fibrosis. यानी कि अगर फॉर एग्जाम्पल हम कोई भी फॉरेन प्रोडक्ट अपनी बॉडी में इंट्रोड्यूस कराते हैं, चाहे वो एब्जॉर्बेबल हो या नॉन एब्जॉर्बेबल हो, फॉर अ सर्टेन टाइम हमारी बॉडी उसके अगेंस्ट एक रिएक्शन करती है and that reaction leads to some level of fibrosis, and this fibrosis can lead to lymphatic obstruction, which is why you must have seen that so many people have puffy faces after filler injections. So all these problems are not present when you use fat for your fillers. ये स्ट्रक्चरल चेंज हम कुछ और माइनर सर्जरीज के थ्रू भी कर सकते हैं. फॉर एग्जांपल हमारी पेरीऑर्बिटल मतलब आंख के आसपास वाली रिजुविनेशन के थ्रू. फर्स्ट ऑफ ऑल, पेरीऑर्बिटल एजिंग का कॉज क्या है? नाउ एज वी एज, स्किन इलास्टिसिटी डिक्रीज होती है एंड हमारे ऑर्बिटल फैट पैड्स विच आर फैट पैड्स अराउंड द आई, वो प्रोट्रूड करने लग पड़ते हैं. सो एज दे प्रोट्रूड आउट एंड दे पुश द स्किन आउटवर्ड्स, they lead to formation of eye bags. To correct those, हम surgically, these are all minor surgeries, इन culprit fat pads को ट्रिम आउट कर देते हैं एंड एक्सेस स्किन को रिमूव करके उन्हें वापस सूचर कर देते हैं. फॉर बोथ दी सर्जरीज, फॉर बोथ अपर एंड लोअर ब्लेफेरोप्लास्टी, द स्कार इज मिनिमली विजिबल. अपर ब्लेफेरोप्लास्टी का स्कार हमारी आईलिड की स्किन क्रीज में ही छिप जाता है एंड लोअर ब्लेफेरोप्लास्टी इन मोस्ट केसेस कैन बी डन ट्रांसकंजक्टिवली. दैट मीन्स कि वो हमारी आईलिड के अंदर वाले रीजन के थ्रू ऑपरेट किया जा सकता है. Now a lot of people have this question regarding periorbital surgeries कि इससे आंख में कोई दिक्कत तो नहीं आती, whether the surgery involves anything with the eye. So the answer is no. हमारा orbit and these periorbital regions are completely separate regions and they have nothing to do with the eye. Obviously during surgery we have to be careful regarding certain things not to damage the periorbital muscles, but if those core principles are intact, there is no risk of any injury to the eye. Now that we've covered the periorbital region, the next part comes the mid face, जिसकी primarily rejuvenation हो सकती है with the rejuvenation of the fat pad, which is what we do by fat grafting in the mid face and the cheek region. इसके थ्रू हम cheek को minor lift दे सकते हैं and एक fullness provide कर सकते हैं without causing puffiness in your face. So there is another thing जो कि हम fat grafting के साथ कर सकते हैं, that is intradermal fat grafting. In this case हम, for example, if this is the depth of your dermis and यहाँ wrinkles हैं, we can inject fat into this dermis. This leads to improvement in the wrinkles. This is called as SNF, sharp needle intradermal fat grafting. This is a very useful procedure if you have wrinkles, and we can decrease those wrinkles to a big extent by injecting fat into it. After this, the lower face and the neck region. The best way to rejuvenate this region is surgical, which is an absolute procedure in which the aim of the procedure is to decrease your biological age by up to 20 years. So surgical procedure for the lower face and the neck region are facelift and the neck lift surgeries. Now, due to the descent of the fat pad pads and the muscular layer in our lower face, उस layer को हमने lift करना है through surgical intervention. Who are these surgeries for? This is for somebody who wants permanent solution and they are okay with a little bit of downtime, because right after surgery you will have some puffiness जो कि edema रहता है after surgery, and this will go away in the next 2 to 3 weeks and can persist to up till a month, but you're usually socially acceptable by 3rd to 4th week. We'll talk about the details of these surgical procedures, these major surgeries in another video, but let's get back to facial rejuvenation. After we've done the structural changes, it is very important to improve the quality of the skin. How can we do that? So surgically we have the option of micro needling with nanofat. Now what is nanofat? Nanofat is basically what we do is we liposuction fat out of your own body and we process it so that उसके fat cells break हो जाते हैं. Now as these fat cells break, उन fat cells के अंदर से there is actual release of stem cells and factors which help in rejuvenation. So through microneedling, which is essentially a delivery system, we drop these nanofat inside the deep dermis of your skin. With microneedling, हम एक certain depth तक जा सकते हैं and at that depth we have to deposit these nanofat cells. इसकी recovery is very good in the sense that for any surgical procedure, if we use nanofat, it leads to faster recovery, there is decreased edema and the overall rejuvenation is quicker. Another big reason to use nanofat is it has certain factors which increase lymphogenesis. For example, when we inject nanofat just beneath the skin, वहाँ पे lymphatic flow increase हो जाता है and that leads to all the more decreased puffiness in your face. What are other things that we can do to increase the quality of the skin? We need to start you on vitamin C and vitamin A depending upon what is the current quality of your skin. This has to be in a regimen and it is better that you start these supplements before you even undergo surgery. All these procedures of facial rejuvenation, which include microfat, fat transfer, microneedling with nanofat, SNF, the sharp needle intradermal fat grafting, ये सारे procedures, they have been pioneered by Dr. Tonard and Dr. Verpale in Belgium, and I had the lucky opportunity to be taught under them. I was a fellow for 3 months and I hope to bring all these world-class, very precise techniques to our region. Thank you.